We have with us Mr. Bindu Prakash, an assistant professor in the Department of Medical Imaging Technology at Charkos Institute of Allied Health Sciences, Mysore, Karnataka. He has been a guiding force for students and professionals in the field of medical imaging with a solid foundation in both clinics and academics. Sir's dedication to education is truly inspiring with more than 8 years of teaching experience. Sir also has 1 year of clinical experience. In addition to his teaching role, Sir is an influential figure who serves as a National Council member 2023-2024 for the Karnataka zone. His expertise is not limited just to the classroom, as he has actively participated in numerous state and national conferences, constantly keeping himself updated with the latest trends and advancements in medical imaging. We are extremely fortunate to have Sir with us today. Without further delay, please join me in welcoming Mr. Bindu Prakash. Over to you, sir.
Okay, good afternoon, everyone. First of all, I thank to Acharya Institute of Allied Health Science for me giving a wonderful opportunity as a guest speaker. Special thanks to Mr. Swapnil Shetty, Assistant Professor, Department of Medical Imaging Technology. Well, screen is viewing.
Yes, sir, it is visible.
Okay, today I'm going to
put it in presentation mode, sir.
Ma'am, it is coming like this type only because I prepared.
Okay, sir.
Okay, today I'm going to be discussing about diffusion tensor MRI and fiber tractography. Okay, over to the context. What all the things today I'm going to be discussing means introduction of the DTI, what do you mean by diffusion tensor imaging, fiber tractography, what is the physics of DTI, what do you mean by mean diffusivity, what do you mean by fractional and anisotropy, what is the color coding, what is the clinical applications of the fiber tractography, and what are the limitations of the fiber tractography. First, I am moving to the introduction. What do you mean by diffusion tensor imaging? Diffusion tensor imaging is nothing but it is mainly we are going to be demonstrating the white matter. Where mainly we are going to be see the white matter means mainly we are going to be seen on the brain. In the brain, what we are going to be do? We are going to be see the network of the nerve fibers that will be allowing the communications between the different areas of the brain. Means where the nerve supplies are going to be seen on the brain. Means this study is mainly completely going to be done by the brain. Okay, once more I'll repeat. Diffusion tensor magnetic resonance imaging and fibrotactography are the new methods that can be demonstrated the orientation and integrity of the white matter fiber. Next, what is the objectives of the diffusion tensor imaging? Identifying the clinical significance. What are the clinical significance we are going to be seen? Either any clinical applications or any stroke protocols in some other conditions. Why when we require the diffusion tensor imaging? Because it is not a older technique what we are going to be used. This is the new technique we are going to be used on the MRI brain. Okay, and what we are going to be seen? We are going to be assess the physics of a diffusion tensor imaging. We are going to be assessing the physics of the diffusion tensor imaging. Next, identify the issues of concern for the diffusion tensor imaging. What all the issues are going to be occurred when sometime there will be a tumors you are going to be seen. Sometime it cannot be seen properly on the images. That time what will happen? They are going to be give the color coding for the brain. This one nerve systems. That time the each color is going to be denoting separate diagnosis. On that basis, they are going to be identifying and they are going to be what issue is going to be occur, what is the connections are going to be seen, difference between the areas of the brain. Mainly they are going to be seen. Next, what you mean by diffusion tensor imaging? Diffusion tensor imaging was the proposed for the use of MRI. It is mainly used for the proposed of MRI, and it was introduced by diffusion tensor imaging was introduced by Mr. Peter Bashir in 1994, and it is a MRI technique, and it is also going to be called as a new technique of the MRI. And DTI is a sensitive probe of the cellular structure that works that cellular structure that works by the measuring the diffusion of the water molecules. Means when we are going to be studying about the white matter, there we are going to be identifying how much water molecules are going to be presenting, because there will be the some images are going to be denoting by the black color and some images are going to be denoting by the white color. That what we are going to be seeing T1 weighted image and T2 weighted image. You studied where the T1 or where the grayscale is going to be presenting, and where the white matters are going to be presenting. In that one, mainly what we are going to be seen here, we are going to be seen about the where the water molecules are going to be presenting on the particular area. Next, diffusion imaging is the only non-invasive measurement of the diffusion. Next, it is mainly used for anisotropic diffusion to estimate the axonal organization of the brain. Means mainly why we are going to be do the diffusion tensor imaging, means mainly to see about the white matter where it is going to be presenting. Next, why DTI? Why we require the DTI? Before DTI, the diffusion MRI had developed from the research. Okay, before doing the DTI, it is going to be considered as the research studies. Now, after the research studies, they studied something and they are moved to the practical aspect. Okay, diffusion MRI had developed from the research in the diffusion nuclear magnetic resonance. Mainly, we are going to be studying the nuclear magnetic resonance. Next, enable the applications of DTI methods to the complex anatomy of the fibers tracked in the human brain. Already I told, mainly the study is going to be done by completely to the brain, and it is not going to be studying for the other human organs. Okay. Then next we are going to be see the image. There will be two images are going to be appeared. One we are going to be seen white matters are going to be appeared on the brain, and another one is going to be appeared on the different color of the nervous systems. You can see red color, green color, blue color, different color systems are going to be appeared on the nervous system. That is going to be called as a diffusion tensor imaging. Means when we are going to be studying about the white matter, including the white matter, we are going to be applying the one more application that is going to be called as a fiber tactography. What do you mean by fiber tactography? Means fiber tactography is a 3D reconstruction technique. It is going to be called as a 3D reconstruction technique to assess the neural tract. We are going to be assessing the neural tract by using the data collection. But what we are going to be do, we are going to be take a particular thing. When we are taking the particular symptoms, or when you are going to be take the particular diagnosis, we are going to be collecting the data for the each person, and or a particular person, what data is going to be seen from one diagnosis to another diagnosis. We are by collecting that one, what we are going to be do, we are going to be identifying what the pathological conditions was going to be presented. Next, the results are represented in 2D and 3D images. The results, what tactography you are going to be seen, or what fiber tactography you are going to be seen, the two images are going to be presenting by 2D and two-dimensional image also. You can see three-dimensional image also. That is going to be called as a tactogram. Means we are going to be seen on the 2-dimension also. We are going to be seen the 3-dimension also. Next, we are going to be see the lateral fiber tactography. Means the brain, what we are going to be do, the image is going to be, we are having already, we know we are having a sagittal plane, coronal plane and axial plane. Here what we are doing, when the study is going to be started, once the protocol is going to be started, what we are going to be see, we are going to be seeing the lateral aspect of the brain, and there you can see there will be a different colors are going to be representing. Next, what is the physics of DTI? The DTI provides a quantitative analysis of the magnitude. What it is going to be do? It is going to be given the quantitative analysis of the magnitude and directionality of the water molecules. Means where the water molecules should be presented and where it is going to be appeared, where the black matters are going to be presented and where the white matters are going to be presented. when the white matters are going to be presented, there what we are going to be seeing, there will be a more number of the water molecules are going to be present. By seeing that one, what we are going to be do, we are going to be reconstructing the image. Next, the word tensor. The word tensor indicates the use of 3 into 3 matrix. Already you know what you mean by matrix, what you mean by pixel, and what you mean by voxel. But when we are coming for the DTI, what we are going to be do, we are going to be taken 3 into 3 matrix and with the eigen values, with the eigen values. Eigen values, eigen vectors as it consists two main parameters. When we are going to be see the eigen vectors, it will be mainly consists two divide, that is going to be called as a main diffusivity, and second one is going to be called as a fractional anisotropy. Okay, next AD axial. AD axial diffusivity represent the longest eigen vectors. It is going to be presenting the longest eigen vector. Next, what do you mean by RD? RD is nothing but it is going to be called as a radial diffusivity. Radial diffusivity is nothing but it is going to be presenting the average of the two shorter eigen vector. It is going to be presenting two shorter eigen vector. Next, we are going to be seeing third one is DTI, data acquisition, is done by SI, SE, API. This is the main protocol we are going to be do for the diffusion tensor imaging, that is going to be called as a SE, API, with the application of diffusion gradient in the multiple directions. Means already we are having a 3 directions. One is going to be called as the x-axis, y-axis and z-axis. Okay, when we are going to be see that according to the gradient, what we are going to be seeing, we are going to be do on the multiple directions. Next, what you mean by main diffusivity? That is going to be called as, also it is going to be called as a apparent diffusion coefficient. What we are going to be do after the DWI, what we are going to be do the ADC, that is going to be called as a apparent diffusion coefficient. Next, reflect the average magnitude of the molecular displacement by the diffusion. How much amount of the moleculars are going to be displacing the position in the diffusion thing. Next, the higher the MD value, the more isotropic in the medium. Means already isotope is nothing but we are going to be called same atomic number but different mass number. But here what we are going to be seen, here we are going to be see the isotropic medium, because mainly we are going to be concentrating on the white matter, because without the white matter here we cannot be studying anything, either what you are going to be tell tractography or diffusion tensor imaging, what we are going to be seen, we are not going to be studying. Okay, then here we can, you're going to be see the images. There is a two categories of the images we are going to be seen. First one, T2 weighted image, and second one we are going to be seeing DWI, diffusion weighted imaging, and third one we are going to be seen as a ADC. There you can see in the first row, in the second image DWI, what it is going to be shown, it is going to be shown a small molecular white matter. Means either it can be present as a tumor or it can be present as something stroke or something are going to be finding, we are going to be seen. But that is going to be seen on the diffusion weighted image, that is going to be color is going to be denoting by the white. But when you are coming for the ADC, same what we are going to be seeing the image, the particular area what we are going to be seeing, it will be completely where the small area is going to be seen by the black color. There only you can see what is the difference between DWI and ADC. When we are going to be studying about the DWI, there we are going to be studying about the white matter. When we are going to be studying about the ADC, there we are going to be see the gray matter. Next, what is the fractional anisotropy? Fractional anisotropy is nothing but it is going to be reflects the directionality of the moleculars. Means what it is going to be do, it is going to be given the direction. Which direction? Either it can be moved to the x-axis, or it can be moved to the y-axis, or it can be moved to the z-axis. For that, what directions we are going to be seen, that direction what it is going to be shown, it is the displacement of the molecules. hydrogen molecules or which molecules we are going to be used. And by the variance between the 0 and 1, what it is going to be do? It is going to be variance between the 0 and 1. And fractional anisotropy value of the CSF, central CSF, is going to be denoting by the 0. It is denoting by 0. Then here we can see there will be different types of the images when we are going to be studying about the diffusion tensor imaging. First, we are going to be seeing 1000 number of the molecules are going to be presenting on the DWI, diffusion weighted image. Means that will be denoting by the 1000 molecules are going to be presenting. Next, we are going to be studying about the ADC. In the ADC, there you can see the remaining area is going to be denoting by the light gray scale, but there will be a small area what you are going to be seeing that will be consisting with the dark gray scale. Next, what we are going to be do? We are going to be studying about the T2 weighted image. Okay, T2 weighted image. Next, we are going to be seeing about the player. Next, we are going to be studying about the fractional anisotropy. That they are going to be denoting one side the fractional anisotropy is going to be denoting by 1.032, and another direction it is going to be denoting by the 0.720. But next we are going to be seeing there will be a difference between another radiant image, that after the 680 minutes the right side is going to be denoting by 0.432, but when you are coming for the left side it is going to be denoting by 0.73. But here what we are going to be do, when we are going to be studying about the tensor imaging or tractography, mainly we should be know about the first we should be take about the diffusion weighted image. After taking the diffusion weighted image, we should go through the ADC. Next, we are going to be see the T2 weighted image. But here what we are going to be do, we are not going to be seeing any T1 weighted image on the particular area. Next, when you are coming for the color coding, already we are seeing the red color, green color, blue color, white color. There will be different types of the colors we are going to be seen on the tractography. But when we are coming for the color coding, in fiber tractography imaging, the convention for the color coding, we are going to be denoting why the red color we are going to be used, why we are going to be use the green color, why we are going to be use the blue color. The red color, what it is going to be denoting? The red color is going to be denoting mainly on the transverse fibers. When we are going to be studying about the transverse fibers, or we can call it as a axial fibers. When we are going to be studying about the axial fibers, that is going to be denoting by the red color. But when you are coming for the green color, it is going to be denoting by anterior-posterior fibers. Okay, it is going to be denoting by anterior-posterior fibers, or you can be tell as a coronal image. Next, third one is going to be called as a blue color. It is going to be denoting by the blue color, that is going to be called as a craniocaudal fibers. Craniocaudal is already the rays are passing, or the directions are passing towards the cranium. That is going to be called as a craniocaudal fibers. But when we are doing the oblique orientations, okay, when we are going to be seen about the, this is the normally we are going to be seen about the color coding, that red color, green color and blue color. But red color is going to be seen by the transverse fibers, green color is going to be seen by the anterior posterior fibers, and blue color is going to be seen by the craniocaudal fibers. But when you are going to be seen about the oblique view, that time what will happen? Two number of the colors are going to be representing the brain and our nervous system, and what it is going to be do, it is going to be given the different coloring. Okay, it is going to be given the different coloring. When the red and blue color is going to be representing one direction, there will be a red color, and another direction it is going to be shown as a blue color. That is going to be called as a magneta. And second, what we are going to be seen, one direction or x direction, it is going to be seen as a green color, and the another y direction if it is going to be seen as a red color. But when you are coming for the z direction, it should be denoting by the yellow color. Next, same direction, if you x direction is going to be seen by the green, but y direction can be seen by the blue color, that is going to be called as a cyan. These are the different colors we are going to be seen minded. there will be a three normal coloring we are going to be studying. Red for the transverse fiber, green for the anteroposterior fibers, and blue for the craniocaudal fibers. But including the fibers, when we are going to be studying about the oblique orientation, what we are going to be seeing? We are going to be seeing red plus blue, it is going to be called as a magneta. Green plus red is going to be called as a yellow, and green plus blue it is going to be called as a cyan. These are the different images, different color coding we are going to be seeing. But here what we are going to be do, there will be two different images we are going to be seen. The first image, what it is going to be tell, the fiber tractography is showing the normal course of the superior longitudinal, means FSSLF, and the inferior longitudinal is going to be denoting, and we are going to be see the AF in the sagittal plane. We are going to be studying about the sagittal plane. Mainly there are three categories we are going to be studying. First one, it is a normal course. There are three we are going to be studying. First one is SLF, second one is ILF, and third one is AF. These are the three directions we are going to be seen on the first image. But when you are coming for the second image, what fiber tractography is showing? It is also normal, but when we are going to be seen on the sagittal plane, but it is going to be show the one direction. It is not going to be show the first image is going to be show the three directions, but when you are coming for the second image, what it is going to be show? It is going to be shown by the one direction, that is going to be called as a ILF direction, but it is also along in the sagittal plane. Next, we are going to be seeing different types of the coloring images. There will be 6 images we are going to be seen, denoting by A, B, C, D, E, F. First, what you mean by A? What is A is going to be showing means the image, the whole brain tractography shows. First image is going to be denoting as a coronal image. It is going to be denoting by the coronal image. And second image, what we are going to be seeing, that is going to be called as a right sagittal plane. Okay, it is going to be called as a right sagittal plane. And third one, what image we are going to be see, that view is going to be called as a left sagittal plane. There will be A, B, C. We are going to be seen. First one is coronal image. Next, we are going to be seen right sagittal image plane, and C we are going to be seen left sagittal view. Next, when we are coming for the D, what it is going to be do? It is going to be directionally encoded. It is going to be given the directionally encoded for the color code mapping. It is going to be show the directionally encoded color coded map. Next, we are going to be seen E image. What it is going to be show? E and F. It will be a 3D fiber tractography. What we require the perfect image of the fiber tractography, that is going to be denoting by the E and F. And what E and F is going to be show? It is going to be denoting by the more number of the blue color is going to be appeared. When the blue color is going to be appeared, that is going to be called as a bilateral corticospinal tract. Means there will be a more amount of the veins or nerve systems are going to be denoting by the blue color. When we are going to be seen both the side, that is going to be called as a bilateral corticospinal tract, and it is going to be shows, the arrow is going to be shows. Next, the red color is what? The red color is going to be denoting, that is going to be called as a corpus. Okay, the red color what you are going to be seen on the image E, and on the F you can see on the light, on the green, middle of the green you can see the red color, that is going to be denoting by the corpus. And what green color you are going to be seen on the particular both the side, right and left, that is going to be denoting by the accurate fasciculus fibers. It is going to be called as a accurate fasciculus fibers. Next, we are going to be moving to the structured tensor informed fiber tractography. This is the new technique that is going to be called as a STIFT, structured tensor informed fiber tractography. What is that? The structured tensor is a suitable representation of the scalar images. Okay, we are having a two images. One is going to be called as the scalar images. and another one is going to be called as a vector images. But when we are going to be studying about the structure sensor tensor is only suitable representation for the scalar images, and it is going to be incorporate with the tractography algorithms. Okay, it is not incorporating with the tractography algorithms. Next, in anisotropic diffusion filtering, the ST is used. Structure tensor is used to enhance the certain features of the images compared to the diffusion tensor imaging. Okay, compared to the diffusion tensor imaging, when we are coming for the structure tensor imaging, there we are going to be seen more quality and more qualified images we are going to be seen. Certain enhancement of the images we are going to be seen. Next, the structure tensor is calculated by the edge. It is going to be calculated by the edge, and it is going to be enhancing the diffusion. What it is going to be do? It is going to be enhancing the diffusion in the most useful for the enhancing the sheet like a fiber bundles. But when you are coming for the normal diffusion tensor, then what we are going to be seen? We are going to be denoting the white matters. We are going to be seen by the white matter. There we are going to be studying. But when we are coming for the structure tensor imaging, there mainly we are going to be seeing the enhancing of the image, how the images are going to be enhancing. Next, what all the methods are pre-processing when we are going to be use the structure tensor informed fiber tractography? There will be a pre-processing we are going to be do. First, we are going to be seeing the DWI artifact detection. Okay, first we are going to be see DWI diffusion detection and realignment with the patch. Next, brain extraction with FSL. Next, we are going to be seeing brain field correction with FSL. Next, co-registration. In the co-registration, we are going to be seeing GRE T1 with FSL. We are using the FSL functional scalar longitudinal by using the fast based weighting volumes. We are using the fast based weighting volumes. Next, we are using GR imaging structure tensors with the heads enhancing diffusion. Okay, next we are seeing vessel enhancing diffusion with VD4. Next, WM, we are seeing the GM segmentation with the FSL. These are the pre-processing we are seeing the structure tensor imaging. Next, what are the clinical applications we are going to be seeing? Assessment, when we are going to be studying diffusion tensor imaging or structure tensor imaging, what all the clinical applications you should be seeing is, first one, assessment of the deformation of a white matter by tumors. What all the tumors are going to be denoting by the white matters that we are going to be studying. In which conditions means by the deviations and infiltration and destruction of the white matters. Next, delineation of the anatomy of miniature brains. Next, pre-surgical plannings. Before doing the surgery, they are going to be seen the if it is a critical condition or some complicated brain surgery. On that conditions, what they are going to be do? Normally, they are doing the MRI. For the further studies or further investigation, before doing the surgery, they are going to be do the pre-surgical planning. Next one is going to be called as a Alzheimer's disease. Alzheimer's disease is nothing but detection of the early disease. Next, focal cortical dysplasia. Next, multiple sclerosis. Next, early identification of the peripheral nerve pathology. What we are going to be seeing here, next image, we are going to be see the brain, but it is going to be denoting by the different coloring. But in the first image, what we are going to be called, it is going to be called as a false image, or it is going to be called as a axial image. There, what all the structures we are going to be seen, you can see there, we can see the foot structure, we can see the hand structure, and we can see the lip structure. Why we are going to be seeing this one means, it is mainly going to be occurring by the for error. It is mainly going to be occurring by the streamline of the tractography error. Okay, it is mainly occurring by the negative streamline tractography error. Next, what is the yellow color is going to be denoting there? The yellow color is going to be denoting as the motor fibers. It is going to be denoting by the motor fibers. Why it is not, why we are going to be means do not the reach all the functionals. When we are using the yellow colors, it is also going to be called as a motor fibers, but it is not going to be functioning for the all the applications or all the functional things. Next, we are going to be see magnetic resonance motor activations, or it is going to be denoting by the aqua color, pink, blue color, and pink color. That is going to be called as a magnetic resonance motor activations that you can denoting by the fMRI, aqua, blue, and pink. Next, due to in the part of the superior longitudinal fasciculus, it is going to be denoting by the green color, and that runs perpendicular to the motor tract. It is going to be perpendicular to the motor tracts. But in the right column are coronal views of the typical streamline tractography is going to be resulting. In the right side, what all the two images we are going to be seen, that two images also going to be called as a coronal view of the typical streamline tractography of result of top, and expected anatomy where we are going to be seen on the bottom. Okay, next, what all the limitations we are going to be seen on the fiber tractography means the inability of the algorithm to distinguish the direction of a neural pathway. Next, to determine its function. Next, to identify the presence of synapses along the course of the same neural pathway. Next, conclusion. DTI is an increasingly relevant and popular imaging modality that has been applied to the numerous scientific studies and clinical problems since its invention just over 15 years ago. We expected that the field will be benefit from many futures advances in the diffusion imaging analysis. These are all the references I took. Thank you. But when you are doing the diffusion tensor imaging, mainly I don't think it is not going to be done by the all the institutions when we are going to be studying about the diffusion tensor imaging. Mainly I heard the diffusion tensor more cases are going to be done by the NIMANS. In the NIMANS, they are going to be studying or they are going to be do the diffusion tensor imaging more studies. If you want to see the studies, you should be thorough the subject. But when we are going to see the diffusion tensor imaging, there we are not going to be tell the perfection of the tensor imaging. But the tensor imaging is a new modality and new techniques. They are going to be mainly. But previous we don't have fiber technique. That time also they are going to be identifying the diagnosis. They are going to be do the surgeries. They are doing. But when the modalities are going to be seen, or when the modalities are going to be do, what will happen when we are going to be see the modalities, according to the modalities, the generations that we are going to be changed. Like that time the diffusion tensor imaging also came. That time what will happen, instead of taking the complication things, nicely we can solve the problems and we can be do the pre-planning of the surgeries, in which nerve the patient is required surgery, and where the network of the communication between the different area, where the different areas going to be occurred, or where the difference we are going to be seen on the nervous system, on the particular colors are going to be denoting, on the particular colors what will happen, they can be identified and they can be easy to do the surgeries. By this one I am concluding the my topic. Thank you for everyone.
If anybody has any questions, you can post it in the chat box. So one participant has asked, what is the color code of two cross fibers?
Ma'am, there we are mainly we are going to use the two, this one is going to be called as a corpus callosum and the anterior communication. Means there will be two colors we are using, red and green we are going to be seen actually.
Thank you, sir. Any more questions?
But before doing the study, once you visit the Niman's hospital, there you go for the perfect technique you can be studied. By taking the physical classes only, you cannot be understand what you mean by fiber tactography, how the colors are going to be denoting, what all the protocols they are going to be done. When the diffusion weighted image, after the diffusion weighted and ADC, by seeing these both images, the radiologist and the neurologist or neurosurgeons are going to be deciding either the patient is required fiber tactography. Based on that one, they are going to be seen. But according my knowledge, once you can do the visiting of the Nimans, there you can study, you can see the different types of the cases there what we are going to be studying.
So there is another question from a participant. Which is the best to identify stroke or tumor, DWI or ADC?
Both also will be the part. If it is the stroke protocol, if it is coming, we want to do the both also. Diffusion weighted image also we want to do. ADC also we want to do. We cannot be do diffusion weighted and we cannot telling ADC we cannot be do. When the stroke patient is coming, mainly we should be do T2 weighted image, diffusion weighted image, T2 weighted image, ADC and T2 weighted image. These three protocols you should be do for the stroke protocol. But when we are coming for the tumor cases, that is depends on the surgeons. They sometimes they can be tell full study also. They can be tell T2 weighted only, the stroke protocol only they can be tell. That is depends on the this one. But when we are doing the stroke protocol, mainly we should be do diffusion weighted image also, ADC image also.
So another question is, what is ideal B value for DTI?
Ma'am, I am also not that much perfect on the subject actually, because I am also studied because it is between the 700 to 1000 square millimeter. According my knowledge, I am going to be tell. But when we are going to be studying about the another studies, when we are going to be studying another B values, that can be denoting by 400 to 800. But normally we are going to be taking a 700 to 1000. But it is going to be on the DTA acquisition. But in some other studies, what we are going to be do, we are going to be taken 400 to 800 S per millimeter square. It is going to be used to changes of the microstructural integrity. It is going to be change the microstructural integrity. But normally, exactly we cannot be tell. We can be take 700 to 1000 dollar. But sometimes it is required. Cartilages are required 700 to 1000. But sometimes for further studies we require 400 to 800. But these are the two values we can be used. One value can be used as a cartilage, that is 700 to 1000. But another, when we are going to be studying about the another normal studies or another studies, normally we are going to use 400 to 800 S per millimeter square.
Thank you, sir. Are there any more questions? If there are no more questions, I think we can wind up the session. Thank you, sir, for your wonderful explanation on simplification of the complexities of diffusion tensor imaging. And with your simple explanation, I'm sure the participants can make good use of your topic.
But for my one suggestion, tell them to visit where the MRI, in the MRI where they are going to be do the diffusion tensor imaging, then when they are seeing the protocol only, they can be understand how the protocols are going to be changed. Otherwise, by studying the subject wise, it is not, by practical is different, theory is different. They should be no more theoretical. But for that purpose only I told, if they are going to be visiting, they can be contact Mr. Prakash, Mr. LM Prakash, senior most technologist, Niman's Institute of Neurosciences. He will be available. You can tell my name and you can be go and study the subject.
Sure, sir.
Okay.
We have come to an end of today's session. So before we conclude, let me brief the participants about the very last speaker that is scheduled for tomorrow. We will have with us Ms. Amita Dabolkar, Assistant Professor, D.Y. Patil School of Allied Health Sciences, Dr. D.Y. Patil Vidyapith, Pune, deemed to be University, Maharashtra, who will be sharing her expertise on quantitative susceptibility mapping. Once again, our sincere thanks to both our distinguished speakers for sharing such valuable insights to us, and to all the participants for your active engagement throughout the session despite the change in time. We hope you found the sessions both enriching and interesting, and we look forward to having you join us again tomorrow for another session. See you all tomorrow at 11 a.m. Until then, take care and have a wonderful day.